Good morning for those of you that are on the West Coast, and good afternoon for those of you that are on the East Coast. I'm Mary Minetti, and I appreciate you joining us for this fourth COVID-19 conversation. Our topic is going to be the impact of language in this time of rapid change. You'll notice that there's a quick poll that we are asking people to fill out as we're waiting for a few more people to join. So if you can take a moment to do that, then we'll launch that poll and see who we've got in the room, the virtual room. Oops, I see that I haven't started my video. I thought I did. Sorry about that. It's been one of those kinds of days. So I'm really glad that you could join us. So language is such an important way to communicate, and in the time of COVID-19 with so many rapidly changing pieces of information and different information sources and conflicting information, what we're finding is that the healthcare organizations in a person's local area are the trusted sources of information. So how you communicate and the ways that you're reaching out to all the different communities that you serve is really important. So we're going to be having a conversation about that. And we are interested in what you're learning, what you're doing, what's happening. I want to introduce for you the individuals who are my colleagues from the IPFCC, and I really appreciate their participation. We've got Ushma Patel, who is our Director for Special Projects and Educational Programs, and she's going to be our chat monitor. You can see her waving. She's got a beautiful smile, and I really appreciate
Mary.
your assistance, Ushma.
I'm excited to join today, so I'm looking forward to hearing from all of you.
Great, and I see a lot of you are chatting in as Ushma asked, which is wonderful. And then we also have our technical expert and registration and database manager, Natasha Reed, joining us. And we really appreciate her providing the technical support for this conversation and all of the things that we do technologically. She joins us from a rural area in New York that's having snow and really unusual weather. So we're hoping that we don't lose her for technological reasons, but she is kind of the backbone of our ability to host these conversations. So Natasha, thank you for joining us. So I'm wondering how we're doing on the quick poll, Natasha. Do we have enough respondents that we can launch it?
Yep.
Great. Oh, this is amazing and wonderful. We've got 64%, which is almost 2/3 of our participants are patient and family advisors. So thank you so much for joining. And then we've got about 1/3 who are coordinators responsible for PFCC activities in their organizations, as well as administrative and clinical leaders, risk and safety personnel, and patient experience and measurement and quality improvement staff, as well as community programs represented. I think it's great to have that broad brush, and I think as we're talking about the whole issue of language and messages that resonate with people that are served in organizations during this time, having the perspective of patient and family advisors in particular to weigh in on this topic is going to be very rich in terms of our conversation. If you want to go ahead and go to the next slide, that would be great. I am having a little trouble with my... So people are already chatting in their name and their organization, their country. We are only just using 2 polls primarily today just to find out who's on the call and in what kinds of settings they are being represented in. One of the things that I always think about as I'm preparing for these conversations is how important it is that people come ready to share, to raise questions, and to really be full participants in this. This really is we're all learning together in this time, and IPFCC, although we have a perspective, we really value the expertise that you bring. And so this really isn't a webinar, but rather an opportunity for conversation. if you want to go ahead and go to the next slide, that would be great. We've got one additional poll, and that has to do with your setting and your environment. And as you're filling out that poll, I'm going to ask you to think about the things that you have found really useful and helpful to you as you have been navigating our new normal with COVID-19 in our communities, and how you have, for those of you that are in the healthcare setting and creating and being a messenger to the community, how have you been nimble in crafting those messages, and how have you partnered with patients and families to do that? Be interested in hearing from patient and family advisors about what kind of messages that they've found really effective and in what ways they've contributed. So I love that we have a good sized group, so we're going to have a lot of diversity of opinion, and that'll be great, but it's also a small enough group that hopefully a number of people can participate. So how are we doing on that poll, Natasha?
I still have results coming in, so I'm going to give it just a few more seconds.
Okay, great, great. And I see that we've got some chatting going on when our other doesn't list a setting that you may find yourself in. So thanks for chatting that in. Oh, okay. So the majority are hospital and medical centers. We have a small representation of primary care, a little more in ambulatory care and home health. Oh, that's great. I love to see people who are out working in the community at this time to be able to share what their experiences are, as well as those representing community groups. I think the thing I've noticed a lot in this particular time is how hospitals are really banding together with community groups to share messages, but also to help in outreach to populations that maybe aren't necessarily as tuned into traditional forms of communication. And every part is important. So if we can go ahead and, oh great, we're all ready to this slide. So I wanted to reflect on a couple things that I've heard and I've seen, and then we'll get into our conversation. So what I've noticed in terms of the language in the time of COVID, and I see it both in healthcare messages, but I see it in community messages, I see it in PSAs, is we're all part of the team. Everyone's important. People find it's reassuring to know what hasn't changed, and often that has to do with our value, how we value the relationships, and then what has changed. This is what's new and why that change has occurred. That's especially important, I hear from different people, because the message might be different last week than it is this week, and so that's really important to set that context. When we are talking with people about what they're thinking and feeling, we're really connecting with them, not just on a fact-based, here are the facts, those are important, but also being able to touch base with people on an emotional level. And then being able to ask open-ended questions can really help us encourage communication to be bi-directional. And then being able to be really clear about what we as healthcare professionals can do, and here's what individuals in the community, patients and families can do, so that we're all on the same page about keeping each other safe. If we can go to the next slide, that would be great. I had a colleague who shared her experience in being communicated with actually her dental provider, and talked about how the best communication she'd personally received that was reassuring was from that provider, that there was a consistent tone, there was plain language, that there was ongoing communication that reached out to her. So one was being clear about what's happening early on in the COVID-19. The second communication was when they did close, reassuring patients that they were always available for emergencies. And then the third communication most recently was that they were going to be reopening because they've met the CDC guidelines, and detailing all the safety precautions that they're going to take. And so I'm going to load an example of that communication into the folder from this conversation, just so you can see an example, because it is really important that we understand the importance of our ongoing relationships with our patients and families, and that they get messages from our specific organizations that can help them feel that they know what's going on. If you want to go to the next slide. I wanted to just share a couple really quick examples just to get going. But this is an example from Children's Mercy Hospital in Kansas City. And they really are all about setting the context and then providing useful information. And so on their website, as an example, they really communicated that this is constantly changing and who they're using as their reliable sources of information, and then consistently sending the same message about what's not changed. And one of those things is the important partnership that parents have with their children and with that organization, and they're not considered visitors. If you want to go to the next slide. I also wanted to give you an example of, they had initially canceled surgeries, and the communication staff took the lead in this rapidly evolving time to craft a message that staff would use on the phone to reach out to patients who'd been scheduled for surgeries, but the surgeries were needing to be canceled. But they ran it by their patient and parent advisors. And what you see is that both the initial message, but then the after message that was created by the parent advisors. And what I really loved about this message, and it really is kind of best practice, is that not only are we getting right to the bottom line, which is your surgery is being canceled, but that they're really talking about why that's happening and what guidelines they're using. And then they're really clear about the why and what's going to happen next, so that people kind of their expectations are being managed, and that they understand that the canceled surgery is going to be rescheduled when it is safe. And also recognizing the important role the patients and families who aren't receiving services are contributing to the conservation of PPE and supplies and things during that time. And so that was about a month ago that they had that particular communication out. But it's a really great example of how important it is to, as we're crafting messages, even in really tough times and when we have to do things fast, that they took about 40 minutes between when they received the communication staff initial, here's what's going to be the script, to when advisors and the program staff, who are parents, were able to comment on and make suggestions. So it wasn't a big delay. Often there's this assumption that if we involve patients and families that there's going to be a delay. And in fact, that isn't the case. So if we want to go to the next, so I'm interested in kind of opening up a conversation now. We've kind of set the stage, shared a couple examples of languages, but I want you to think, what messages have you found most reassuring and helpful during this time? And if you can chat in words or phrases that build partnership or reassurance from your standpoint, take a moment to do that. If you are a program staff person, how have advisors been helpful in crafting important messages? And I encourage you to feel free to unmute your lines, excuse me, and share what has been your experience. So what has been reassuring and helpful for you as an individual, or for other family members who've given you feedback, or for staff that have crafted messages and then gotten feedback from their group? What really has helped? So I'm going to open up the lines, and if you're on mute, I encourage you to, if you have something that you want to share, I encourage you to share that. It's great to see your faces, for those of you that are able to be on the video. That's great.
Hi, this is
Mary.
Erin.
Oh, Go ahead.
Thank you. Sorry, this is Karen Anthony from Children's National in DC. We had a focus group recently, last week, that brought together a bunch of folks to talk about what happens in the case where restrictions are going to get tighter. It's already been difficult with how you handle family members who are going to come in and be with their child, but there are certain cases that were popping up in the institution where there might be a family member who has a very high risk of exposure, or they were doing screening questions for people walking in the door to see what their risk of exposure was and what was going to happen. And there was a lot of discomfort from folks thinking, well, if I say I've been exposed or I have a symptom, are you going to tell me you're going to separate me from my child? And what does that mean? And who's going to be able to be there for my child? And in fact, that's true. If somebody comes in and says if they have a fever or they show symptoms, they're going to say, I'm sorry, you're not allowed to come in inpatient. But even in those difficult circumstances, what came out of the group discussion was, we need you to tell us what's going to happen if, because people were worried that if we ask these screening questions, people are going to not tell the truth because they're afraid of the implications of that. So we need to be able to set the expectation correctly that if we think that your an exposure is a risk to yourself or other patients or our staff, we're going to do this, and then we're going to be able to help connect you in this way. But that transparency, even in the scariest thing a parent can imagine, is incredibly important to build trust to be able to go forward.
So that was a really important conversation and focus group that really helped you understand how important that message was. Karen, I really appreciate you sharing that. I think it's interesting that the information is, here's what we're going to do, but here's what we're also going to do to keep the connection as close as possible, even though there's going to be some physical distancing. And I think it's kind of that what's changing, but what's the same? What's the same is we're committed to you for that, the importance of that relationship you have with your child, and we're committed to safety. And so here are the things that are going to happen. This is a great example, Karen, and I really appreciate you sharing it. How has that changed how you approach things? Have you coached the people that are at the front area about some messages?
That's a good question. For the patient experience folks, we're taking that messaging out and figuring out what we're going to do at the welcome desk and what they're going to do in their particular areas in the institution that are set up for if you've been exposed to do the sort of risk management and sort of thing. It was also really important for that ongoing relationship trust to feel that this was an authentic communication. And I think that was really important for a lot of the folks who are coming in now with their child. They're not coming in for something that's sort of no big deal. They're coming in because their child needs care. So that means you have a long-term relationship with this family, and you want to make sure that they don't think that they're going to be harmed. They want to feel like you're going to be honest with them, and you want to feel the institution wants to feel that the families are being honest with them too. And that's a hard thing when people would be more likely to say, I'm just going to not tell you something because it might be scary and it might harm what I want to have the outcome.
Right. Yeah. Well, thanks for sharing that. Dejo, I think you had another comment that you were going to make, so I want to give you an opportunity to share that. And then there are some things I want to bring to people's attention in the chat. Dejo?
Sure. With us in creating the messaging here at Children's Mercy in Kansas City, we have some parents on staff that have been a part of all of the task force meetings, and but then so that we can hear kind of what the discussions are at the leadership level, we can pose those questions and gather feedback from all of our PFACs whenever they're meeting, because we're having virtual meetings. So then we've been able to take that feedback back to those task force meetings so that all of the leadership can hear that, and help form how they are thinking about messaging. I think we've just really kept that parent perspective and the need to have that incorporated into the messaging at the front and forefront of everything. Our executive leadership calls that out pretty regularly, just of saying where they're getting the feedback from our parents and families, so that everyone understands that, which then just kind of makes it how we provide care. So this morning, we had a small team meeting with communications and marketing at 8 a.m. Talking about communication and how the dissemination plans are going. Then at 9, we had our huddle. And then at 10, I was on a recovery team meeting for registration and talking about how, we'd gotten feedback from families that they didn't want to touch screens when they come in. How are they going to register without having to stand in line or touch a screen? So that had already been communicated throughout the process, just as we just have this continual information loop going back and forth. And so, they said they had the capability of making QR codes for families to scan and check into clinics. So hopped off that meeting. Cheryl and I created, the bullet points for communications and marketing to be able to take that information, and we shared that all within 45 minutes. And so it's just kind of now built into how we're doing everything, that they can't do it without the feedback, and not just feedback that we get from our PFACs, but what we're hearing nationally. So across the listservs and that information that we're hearing from hospital systems who are a couple weeks ahead of us, we can take their lessons learned and start asking those questions of our PFACs and get, how people feel in Kansas City, so that we can make it specific to us, but we're learning from each other. So it's just, I think, creating those lines of communication internally, so that you can gather information from your partners, your parent partners, and just always have that incorporated into how you're moving forward.
Great. Thanks, Dejo. I'm noticing that there's a lot of great stuff going on in chat, and some great language about we're all in this together. We are strong, which implies partnership. We are here for you, but also we are here with you. Donna, you're talking about that you're looking at some alternative messaging opportunities and sharing Spanish materials for dissemination. Did you want to share any information about your alternative messaging that you're thinking about? Do you want to get off mute, or are you able to get off mute to tell us a little bit more about that?
Here we go. Sorry, it took me a while.
No, sometimes it does take a while. No problem. Thank you, Donna.
Okay, some of the areas that we're taking a look at are working with some of the local Spanish groups, as well as talking to some of the media to see whether or not there's an opportunity to leverage the expansive nature of their reach and creating the coronavirus information in Spanish, because we honestly have a sense that if we can, there's lots of messaging going on in English, but we think that there's still tremendous opportunities on the Spanish speaking side, as well as the other languages, to reach out to the public. So we're looking at those alternatives. It's brand new. We're looking at doing some of our own videos and posting them online as well. So we have a wonderful, in one of my groups, we have a wonderful Spanish liaison who's marvelous, has just some wonderful contacts, and does a lot of the scripting and the writing for us. So it's helpful for, it's easier for us, I guess is my point. And we're looking forward to seeing how we can leverage that, not only that access, but the creativity that we have in the group.
That's
so
wonderful. That's very helpful. And what I love about that is one, you're inviting people in who represent that group because they understand the culture and they're thinking about language in a different way because they experience it differently. And I think broadening our perspective is really important. Literally 10 minutes before this call started, so I can't speak at all to all the depth in this, but there was an article called Striving for Inclusivity in COVID-19 Public Health Messaging, and really had some best practices from Johns Hopkins and a variety of other people. I will put the link into the folder for COVID-19 for this particular conversation so that you can read it more specifically. And the link is really long, so I can't read it out to you. But it had some great things to think about. And it was talking about, we've got to be really sensitive to even beyond Spanish speaking. Your population might be very diverse and many other languages are being spoken. And so how can we make sure that those basic languages, those languages that people have, can be utilized to get the message out. And also later in this particular slide deck, there will be a link to a COVID-19 site that's a health literacy site that basically has basic COVID-19 messages in 30 different languages. They brought a group together in the Harvard area. And so I put a link to that because people may find that helpful. So that's great. I'm looking at,
Mary,
yes, Donna.
for thanking, I can't thank you enough for bringing this topic and the multitude of options that people have. I really appreciate that. Thanks.
You bet. Well, we're not creating those Harvard resources. What I love is that there are so many people really taking initiative, thinking about the populations that they serve, and then they're very generously making all of that information available to whoever would find it useful. So I think that's great. I noticed that, Mindy, you put in some language in the chat about a potential script that might be helpful to share, and I wondered if you wanted to share anything more about that. Is that a script you're currently using or one that you would suggest? Because I thought that there was some nice language in there.
I didn't use any specific script. I'm telling you from the other side. Patients call me before they go in. I'm also a doula, and ask me what can they expect in the hospital. They're not reaching out to the hospital first. They need to be told exactly. And as you said, things change literally momentarily. I've also had patients who ultimately don't admit what their status is because they're afraid they'll be sent away. And they need to know that that may be a possibility, and think about who else you can bring. How many people can come? What happens if you leave? So it's not a script that I've developed. It's just when people call me, I know what they're asking me. And I'm so surprised that they don't know, particularly in labor and delivery, where these are expected admissions.
And what's really important is that you are perceived as a trusted connection to those individuals. And so sometimes people in your position, community resources can really help link people to the information and keep up with the information that's out there. I mean, it's a really important role that you play during that time. And that was one thing that was in that article, is they did talk about reaching out to trusted resources for particular populations so that they're in the loop on the communication and can bilaterally share things like, you could share, these are the kinds of questions that are coming up that people are asking me about, and here are ways that I've found really helpful to be able to communicate those messages so that you're kind
So
of.
what I have done in the crazy days when things literally were changing hour by hour is I found out what hospital policy is and sent that out on all my own WhatsApp groups and community chats and things like that. But if I don't have the information, I don't have it to pass on.
Exactly. Yeah. So building those relationships is really important. And and the organizations being as proactive as possible about reaching out to you, not just you reaching into them. So I think that that's really important. We were talking about people who are going in for birth kinds of things. Pam, I think you made a comment in chat about some messages that are happening in the Birth and Wellness Center in your area. Do you want to share any more about that?
Sure. I can't take credit for any of that, of course. I just received them as a patient. So they've been great about sending out weekly messages that are COVID-19 updates to let their patients know what to expect and how their services are changing from what their patients might normally expect. And they've been very clear about what visits will look like for different purposes. So, you know, that if you're pregnant, these are the types of things that you can expect. This is when you will see, when you will have OB visits. This is when you will be in office. This is when you'll do telemedicine visits. When you come for your delivery, this is who you can bring with you. This is what that will look like in terms of the physical space. This is how your postpartum visits will go. And I think there's also been a very clear message of, because they are the primary care provider for a lot of people as well, they've been very clear about messaging around chronic health conditions and not wanting to let people avoid care for things like depression or high blood pressure or, you know, thyroid conditions, things like that. So have said, you know, please touch base with us so that we can figure out how to proceed and make sure that we're still taking care of those aspects of your health as well. So, you know, they've done a great job about just trying to provide education and also a message of togetherness.
That is really important. And I think, Stephanie, you made a really important point about that the messages that we need to be sure that our messages reach marginalized communities, those who are being disproportionately affected by COVID, so that they understand that we want to help that not be the case, or we want to help especially keep them safe. And that's, I think, where the community outreach to trusted resources can help spread that message more broadly. Did you want to share any other thoughts about that, Mindy? Because I think it is so important as we think about language and messages and connection, because that really is the point of communication, isn't it? That there's a deep connection and that we build trust. And in this situation where people are being disproportionately affected, that can kind of erode trust.
I think that part of the issue is really making sure that there's an established connection between the community organizations. I found that the politicians who do send out weekly local messages to their whole constituency, explaining, you know, various things that are going on, are particularly important. But to keep in mind, who are those community people who can get the messages out, aside from your typical hospital connections. But some of the suggestions that have been given now are absolutely fabulous.
Great. And Erin, you made a comment about even thinking about student health centers and how they're reaching out to students, even though the students might, you know, not be on campus or might be, you know, having to learn from, you know, their apartment because they're sheltering in place. So that, and outlining the telehealth services, which for many people, that's a whole new ballgame. And so how do we create some comfort and some familiarity with that in a way that we can prepare people to have that be a positive experience? Do you have anything more you'd like to share about that, Erin?
Sure. Hello?
Yes, we hear
Okay,
you.
yeah, sure. Yeah, it's really reassuring that the student health care center is still dedicated to providing so much care for all these students, especially those who are like part of these underserved populations. Just for example, like on a personal level, like I went back to Orlando, Florida, because of this outbreak, and I'm on my university's health insurance plan. And so it's really reassuring to know that I can communicate with my PCP if I have any questions regarding my health.
Mm-hmm, mm-hmm. Great. And I think there was another chat, and I love, well, let me just say before I go on to this next connection, Erin, what I love about this is that they're not thinking about, well, you're out of the local community physically, therefore that relationship is severed. It's still there, that they're really communicating that message that you're still part of our community, and that becomes really important. So Sue, you talked about your CMO has been attending your PFAC Zoom meetings. Can you talk, and about reopening communication, can you talk a little bit about what you're hearing, what you and other patient advisors are sharing about back to the CMO about communication related to reopening?
Yeah, it's very similar to what Dejo said. I mean, we're actively involved. I'm a paid parent advisor, so I feel like I'm on every workforce and task force about reopening, whether it's ambulatory, whether it's our clinics, and whether it's the hospital itself. I think we're getting information from a variety of ways, but our meeting is next Wednesday, and that's pretty much the topic. She's come and she'll give like a 15-minute COVID update as to the state of the hospital, what we're seeing, what's going on, and then really try to flesh out from parents. You know, we had about 50 on the call last time. What do you need to hear from us? What will make you feel safer? And it's really what a lot of the folks are saying. Is we want videos. We want to know what it's going to look like. How are the elevators going to work? How does the parking garage elevator work? How do I get from here to there without passing too many people? Is the cafeteria open? It's all of these like basic questions that we're just hoping that those details give them a broader range. But we are kind of handicapped because we are a children's hospital within an adult hospital. So we kind of have to work together with the adult side. And that's at times can be a struggle, because I think sometimes we're ready to move forward faster than they are. So, but we kind of have to figure out how to work together. The town halls that we've kind of created, I don't know if anybody else has been going to like 1 million town halls because of your kids' schooling, or I have a senior who's going off to college, and so that college did a town hall, and so it gave me the idea of we need to do town halls. Like, I want to hear from my physician. So we encouraged the oncology folks to do a town hall, cardiology, they're going to do a town hall, endocrine with their diabetes patients. They're going to pool the patients that they've seen in the last year and send out a mass email. And we put together slides. Unfortunately, since it was our idea, we get stuck moderating it for everybody, which will be interesting. But we're really looking forward to, because I think people really want to hear from their physician. That's who they want to hear it from the horse's mouth, that it's okay to come back and this is what it's going to look like. And our biggest thing, I think, is letting the physicians know it's okay to say, I'm not sure, that we're still working on this. We're working out the kinks. This is what we think, because I think everybody gets that it's a changing situation.
Great.
And the grand rounds also has been really, really popular. I don't know if your institution does grand rounds with your residency programs, but nobody used to go to grand rounds because you had to go in person. And now that it's via Zoom, I mean, there's hundreds and hundreds of people on the call. It's become a very interesting way to get good information. And by incorporating the community, nurses, school nurses were invited to the last call, pediatricians across the street. It's really been a good way of getting people connected. And then I think good things happen behind the scenes.
Great. Joanna, I know Salenza, you were going to share some of what's going on in your institution. Is this a good time?
Sure. I just had unmuted myself. Well, I feel like I'm gaining so much insight from what others are doing, and I don't know that I have anything as creative as what you all are currently doing. But because I work in our intensive care nursery, that environment is much smaller, so I feel like there's more that we can do locally to promote this feeling of partnership. And I returned to work yesterday for the first time, and I was just struck by the calm feeling in our nursery, which was very reassuring to me. So I think that messaging has been heard by families. I think families feel welcome there. I think they feel safe. But now I'm thinking more broadly, because we are also a children's hospital within an adult medical center. And so some of these ideas about town hall meetings, and I'm just really fascinated by what you all are doing. So again, I don't know if I have as much expertise as some of you. I feel like I'm learning quickly, but.
Great. Well, thanks for sharing. Dijo, I saw a thread about you're creating some videos and people are interested in hearing the topics of the videos and how that's coming. Do you want to get back off mute and share some real-time update and detail about that?
Sure. They're in production right now. But what visually be able to see what's changed and how, just to reduce some of that fear. So they've been, I think, filmed and they're kind of in editing right now, so I haven't seen them, but short little snippets so that they can be easily updated as there is something that changes. So, we've gotten QR codes for getting into clinics until we can get that added to our Children's Mercy app. And so that will change, and they'll be able to change how that, will work for families. So what they've really taken is just the whole process of getting into clinics or, going to admissions and walking through those steps so that families can choose which video that they want to see instead of having to watch one long video and pull out what they need. So those will be uploaded then into our website. And also they'll have them in text so that they can be shared. Our Spanish Speaking Advisory Council is meeting tonight, so they are providing guidance to us on what they like when there's voiceover or how to do that, and give us feedback. So the videos are really just taking what we would have written down, walking through those processes and showing them to people so that they can actually see what does the screening station look like and be more prepared when they come in, and just remove that anxiety from the visit.
Great. Well, and then once they're on your website, will they be available for anybody to click on and see as an example? Great. Yeah. And you might, when that gets set up, you might send that link to Natasha and she could post it if you don't have time. I know you're pretty busy.
I can send an email.
That'd be great.
Okay.
I noticed that Kelly Goodson's on the line, and I listened in on a panel that she did with patients for Vizient and their affiliated hospitals, and she indicated and sent a link related to a recent report. But do you want to say a couple things about that, Kelly?
Sure, thanks, Mary. Yeah, we were excited to have a panel of patient and family advisors from our Vizient member healthcare institutions across the country, and really just got excellent feedback around restarting elective procedures. A lot of our members are talking about restarting elective procedures, and we kept asking them, well, how do your patients feel about this? Will they actually come? And none of them really had the answers. So we convened this panel and really came out with some good themes that are concerns for patients and families, and things that the healthcare systems need to think about as they're reopening, many of which I've heard said today. One of the things is that there's no detail too small about, I heard someone mention how's the elevator going to work, and how are things going to be cleaned? How do we know it's safe? And really, what's changed? Why can we start having these procedures now when just even a few weeks ago the answer was no? So really rich discussion. We were able to compile everything into a report, so I put the link in the chat, and feel free to take a look at that and share that with your partner healthcare organizations, because I think there's really great information in there.
Great. Well, and thanks for doing that and facilitating that conversation and then sharing it more broadly. And there's probably a part of you, at least for me, I was reassured when you said in the chat, you know, what I'm hearing with this group is similar to what we're hearing, you know, from our patients across the country. And the part that was very eye-opening to me was the difference perspectives that people with different kinds of conditions had about the whole issue of reopening and reconnecting and re-engaging with healthcare.
Yeah, Mary, you know, one of the things that I think was the biggest aha for my folks that work at Vizient and our sister company, our company that we own called SG2, which is a market intelligence company, was around the fact that it's really the patient's personal risk factors and their perception of their own risk that is going to be the determiner of how they move forward. It's not what age they are. It's not what diagnosis they have. It's am I going to be safe from COVID-19? And you'll see in the report, we kind of came up with these different sort of waves. If you think about the bell curve, a traditional bell curve, there's going to be waves of patients and their willingness to do elective surgeries based on their perception of their personal risk.
Great. Thanks for sharing.
Sure.
So it is, I know we have a few people in ambulatory care, which probably has to do with more elective kinds of interactions with patients and families, and also in primary care. I'm wondering if there are some lessons learned from the kinds of things that individuals are doing in the hospital setting that is transferable to primary care. I'm thinking about communications or maybe missed opportunities for communication that at least my providers that have a patient portal really haven't done any outreach kind of communication that's been more outreach. I mean, they've got some stuff on the website, but nothing that's like going into people's homes or their inboxes, as it were, to say, here's what's going on in primary care. And we encourage you to contact us if you think, you know, you'd like to do telehealth or have some unmet needs and things. Is there anyone on the line that's either in an integrated system, so you have both hospital and primary care, or just primary care, that want to share anything about what's happening around communication in your arena? I never know if it's quiet, if people are trying to figure out how to get off mute, or maybe there isn't anything that, oh, Sue, you're talking about what your pediatrician's office is doing. You want to share a little bit about that?
Yeah, I mean, I haven't used them, but I think they're doing a great job. They have different practice, and they're a large practice, one of the largest, I think, in Maryland. They have 5 offices maybe, and I think they're down to now maybe only operating 2. But they're reading nightly stories. Different practitioners read nightly stories. They've done a lot with schooling and social emotional health during this time, doing different Zoom seminars that you can join and talk about, you know, parenting small kids during this time and how to explain what's going on to them, how to cope with your teenagers, really kind of switching a little from physical health to the mental health part of this, which I think has been really interesting, and gaining a lot of following that way. So I've just appreciated it.
Great, great. Thanks for sharing that. So,
Mary, it's Kelly. Can I share maybe a not so great example?
Sure. We learn from the things that don't work as well as the things that do. So please.
And this is a personal example. You know, my husband, before all this started, was scheduled for a colonoscopy in March. And as soon as this kind of kicked up, I said, no, you're not going in for a colonoscopy right now. And so he called and talked with the receptionist, and she was really a little bit, you know, dare I say rude about, oh, you're canceling your colonoscopy because you're afraid of COVID? And he said, yeah. And so he canceled it. And they rescheduled him for May. And so we just called in again and said, don't feel comfortable yet. We want to put this off a little longer, and spoke to that same receptionist, who then transferred him to the scheduler, and the scheduler kind of had a little bit of an attitude as well. And she said, well, I guess I'll put you on the list to call back. And he said, yeah, I'd appreciate that. And then she called back about 15 minutes later and said, kind of, pulled the, well, these are important screenings, and, you need to be sure that you're getting these screenings, and, kind of tried to guilt trip them into it. And we stood fast and said, no, we're not having this yet. And, call us back. So it was an interesting experience. I know that the providers are starting to feel a little, weary about their situations, but there was no assurance of safety at all. It was more questioning our being scared about COVID.
Interesting. Yeah, it reminds me of how important it is, not just how important communicating empathy and caring is at a time like this, and that the situation that you're describing is very much, I have this job, I'm supposed to schedule people, I'm probably feeling some pressure, and therefore I'm just going to pass that along to you and figure out how I can put enough pressure on you so that I can check off the box. Because you're right, a number of outpatient providers are feeling a lot of economic pressure. Nonetheless, when we think about
if they could have handled it a different way, a letter from the doctor, an email from the doctor assuring, that they're going to proceed safely, and here are the changes we've made, here are the precautions we're taking. It seems so simple, but yet you're exactly right. They're just rushing through it, and there's pressure on everybody, I think. And, I'm still amazed at the number of organizations that are out there that don't have patient and family advisors, that don't have PFACs, that are making mistakes like this, and that will cost them economically, just because they haven't engaged their patient and family, customers, if you will.
Yeah. And Angela just wrote about a recent PCP experience that she had related to masks and the inconsistency around that. And it's just a reminder of, it's not just the words that you say, it's what you demonstrate in your behavior. And when I look at some of the really good stuff that's out there around, it shows what the percentage is if nobody wears a mask of infection, and if one person wears a mask and another person doesn't, and really understanding that when I wear a mask, I'm protecting you, and when you're wearing a mask, you're protecting me. And so what is the message that unknowingly, potentially, Angela, that your PCP and their staff is communicating when they don't reciprocate that protection to you? So it's very interesting. My husband actually had throat cancer and had surgery, so he has follow-ups in Portland. He has an appointment and things have been good in Oregon in terms of the hot spots have gone down and all that stuff, but they're actually having him take a COVID test before he goes in to see his throat person to check on his his recovery and stuff. And it's just a standard procedure. They do it with their staff, and they also do it with their patients. And so that felt very reassuring to us, because the person's going to be down his throat and he's going to be breathing on the person, because masks won't happen. So anyway, Ushma, I just want to turn it over to you for just a minute. There may be things that we want to encourage people to share out loud that were in the chat, and it was a very wonderful chat and pretty full of rich suggestions and things. Do you want to summarize anything or call on somebody who I may have missed?
Sure. No, the chat was wonderful today, very rich and engaging. Juanita brought up a wonderful point about continuing the idea of grand rounds via Zoom, which is wonderful. Even, when the pandemic is over and we go back to reality and face-to-face options are there, we can involve a lot more people, continuing those different types of technology.
Great.
And then Karen as well brought up a great point. I don't know if she wants to unmute and elaborate regarding the importance of hearing directly from the provider and not just the general messaging from the institution.
Great. Anyone that Ushma mentioned was in the chat want to share any additional information? Okay, well, I'm noticing, as I always am, that it's like 5 minutes until the end, and did somebody take themselves off mute?
I don't think so.
Okay, and what I noticed is if we go to the next slide, there's a whole series of questions that people had that we have addressed a number of them, but obviously we're not going to get to all of them. And so they'll come out in your materials that Natasha will send out in about a week or so. And so if there's something in that question that you may have something to add, I really encourage you to discuss that in our virtual community, our COVID-19 community. If we want to go to the next slide, I just want to kind of wrap things up and be sensitive to your own other things that you have to do today. I was talking about the literacy site. This is the link to over 30, I think they're up to 35 languages that have basic COVID information about how to keep yourself safe and how it transmits, and in real plain language, but also in the language of a person's primary language. And so that's a great resource. If you want to go to the next slide, Natasha. We on our website, our IPFCC website, do have best practices related to COVID. We really appreciate anybody sharing any additional information that we can either spotlight or helpful resources. The one thing that I did want to let you know is that we're working with the University of California at San Francisco, and we have created in partnership and collaboration with them, we have created a tracker tool that is gathering systematically information across the country from both pediatric hospitals as well as adult hospitals on what changes they've made to their family presence policy as a result of COVID, and also how their advisors are engaged. And so we will be posting the link to that tracker tool, so that if any of you representing your organizations wish to participate in kind of that national survey in a systematic way of what's going on out in the hospital setting, we encourage you to do that. We will be posting that tracker tool on Thursday. So it will be available from this website. If you want to go to the next slide, that would be great. Be sure and utilize PFCC Connect ongoing between these conversations. There's some really nice stuff going on there now. And if you're not signed up to be a PFCC Connect member, obviously that's a starting point. But if you're a member and you're not receiving, and you can do that according to your preferences, if you're not receiving notification of discussions that are being posted, that really requires you to kind of put it on your own tickler. So if you want to get at least a weekly summary of the discussions, I encourage you to go in and look at what your current profile is. So I wanted to let you know that we are going to be hosting another conversation in 2 weeks from today. So that I think is the 26th. And that topic is going to be on PFACs in the pediatric in the pediatric world, children's hospitals, and how those PFACs are operating in the COVID-19. What are the challenges? What are the strengths of those relationships? And so that's a very kind of, anyone's welcome to join that topic, but it's specifically on that topic. And I wanted to give you kind of a heads up about that because it is the day after Memorial Day. And I don't know what Memorial Day will be like for a lot of people, given that a lot of us are sheltering in place, but I just wanted to let you know. Also, if you want to go to the next slide, Ushma has posted, this is what we always do. We get everything, the chat, the recording, and it's posted so that if you have colleagues who haven't been able to hear this and they want to actually listen to it or look at the resources themselves, they can go to the COVID-19 community and find that on our PFCC Connect website. Ushma has listed the link, next slide and last slide, the link to our survey. And I really appreciate you taking the time to fill out the survey because it helps us understand what additional things, general topics you want to talk about, and also how the conversation went for you today. So in the interest of getting you off to your next thing, thank you all for joining us today. It was absolutely stunning conversation, and I learned some great things that I'll be able to share with others as they ask us about what's happening out in the field. So thanks so much for being here and have a great rest of your day. Bye.